Opioid Dependency for Postoperative Patients by Pell. The aim of this project is to increase non-pharmacological interventions by 25% in 3 months to improve pain management and decrease the use of opioids after surgery. Postoperative opioid dependency relates to poor pain management of acute pain that may become chronic pain after surgery. With current rise in opioid prescriptions and the misuse of opioids after surgery, the United States of America is in an opioid dependency crisis. Mayo Clinic staff, 2018, opioids are used to be short-term to treat acute pain and is not used for long-term for chronic pain. Opioid overdose has increased by 54% in 16 states. How to measure success. Patient surveys, pain management trends, numeric scale, and phases. First, management staff will review pain management trends throughout the patient's length of stay through the numeric and phases scale. Second, compare the pain management trends to the patient surveys during visual management that is conducted every day at 1400. The goal is to improve pain management through non-pharmacological interventions like music therapy and guided imagery. Implementation. Place radio docks in 10 postoperative beds out of the 40 beds on the unit. Radio station will be programmed for the classical music channel. Staff will have music playing before patient arrives to the unit. Educate patients on the non-pharmacological intervention program. Have staff facilitate a healing environment for patients with guided imagery exercises for the patients. In a study conducted, 58 participants had surgery. One group of participants were exposed to music as they arrived at PACU for recovery, while the other group was not. The study conducted that approximately 50% of the participants reported less pain than the control group. Music therapy and distractions are used in many magnet hospitals to promote healing and decrease use of opioids. Guided imagery should be implemented with both biological and psychological facts. Guided imagery can help patients cope with chronic pain, depression, and anxiety. Cleveland Clinic defines guided imagery as a powerful psychological strategy that enhances a person's coping skills. Imagery involves all the senses as well as one's whole body and emotions. It is a way of viewing your ideas, feelings, experiences, and interpretations. Imagery can stimulate changes in bodily functions such as heart rate, blood pressure, and respiratory patterns. Framework. PDSA cycle. Plan, Do, Study, Act. The plan is to improve pain management by 25% in 3 months by implementing non-pharmacological interventions. Do. Implement the use of music therapy and guided imagery. Study. Add radio docks in 10 post-op beds, including guided imagery exercises to decrease the use of opioids for pain management. This would include a group of patients that experience chronic pain and acute pain. Act. Monthly at visual management, administration and staff will compare pain management trends and pain management surveys. The goal is to make an impact that will inspire other facilities in the area to adopt non-pharmacological interventions to improve pain and reduce the use of opioids.